who has also been an active member of the Health and Medicine Policy Research Group for over 25 years. Over 25 years. She is Leatrice Berman Sandler. Ms. Leatrice?
Quentin has left a legacy that's all about connections, and connections between healthcare professionals and the community that produces results, connections between labor, business, and healthcare professionals that also move us to action, and connections between government and constituents, and between students and mentors. One of the most enduring legacies is us, gathered here in this room under this tent that we call health and medicine. Once a utopian vision that Quentin shaped with our friend over there, John McKnight. John, please stand. Quentin decided to build an independent health policy center. He didn't do it alone. Part of the vision and part of the plan was bringing activist, independent policy wonks together to work together in a collaborative fashion, not to nod at each other at periodic board meetings, but to actually do the work. To do the research, to write the reports, to then go out, to build coalitions, to convene meetings, and to advocate for a health system that works. And that was really the birth of health and medicine. As a result, health and medicine has been in the thick of every institutional and important initiative in the safety net in this city. The Healthy Mothers and Healthy Babies Coalition, freestanding birth centers, the powerful and potent network we have of community health centers in Illinois, long-term care reform, and regional health safety planning. Margie's going to talk to you more about these programs so that you'll get a sense of what health and medicine is doing today. But my job tonight is to ask you for your support. We know that these are difficult economic times and that things are very strained economically. You all have difficult times, but they don't match the difficulty of the people and the communities health and medicine advocates for. These are also times in which our political environment is mired in clawing its way out of the very dysfunctional morass we are in, and it is deep. These are times when we need to restructure the healthcare system. We can't walk away, we can't ignore it, we have to get focused, and we have to seize this moment and move collectively toward the potential of health reform. So we can't miss this opportunity. This is what unites most of the people in this room. There is no organization in Illinois that can think as broadly, creatively, and effectively as health and medicine to move on these issues in the near future. So to that end, tonight we celebrate Quentin's birthday, but we also launch the creation of the Quentin D. Young Fund for Health Justice. This fund is being created to brand our work and to secure our organizational future so that we can continue to be a politically progressive voice with the capability of long-range planning, fiercely independent but with an ethic to collaborate with all organizations involved. And we are in a good position to move forward. This fund carries Quentin's imprint into the future, and it converts Quentin's energy into additional staff and projects and resources and policy fellowships to bring people to our organization to do the work and expand the work that we can do. So please turn your attention to the envelopes on your table. And as you turn your attention to them, you're probably saying what I'm saying. I've given enough to this organization, and I've given enough to even be at this dinner tonight. But please think again. Join me as you get out your checkbooks and your credit cards. So the sound effects are rustling handbags and wallets. Okay? Even if it's only a token tonight, if you contribute tonight, we know that you're with us. And then when you leave here and you remember this wonderful event and this great celebration, think about health and medicine again. Put health and medicine on your routine contribution list. Become involved in this very concrete way in building our work. We will, of course, remind you to be sure, but I can promise you that this is an investment in the future that will not tank. So thank you very, very much for your consideration, and please, please give generously.